Okay, good afternoon, everyone. I'd like to welcome you to this afternoon's Fast Track TRAKnet training. Um, my name is Dr. Alan Bass, and I'm the medical director for Nemo Health. And joining me on the line today, who's going to be fielding some questions, is one of our top-notch support people, Erica. Say hello, Erica.
Hello.
Hello. Well, thanks for joining me, Erica. So one of the reasons that they asked me to take care of this training in a short period of time is because I'm going to always try to give everybody the best real world experience on how I use TRAKnet and some of the things that I do within TRAKnet. Now you are all, if you've been on these before, you are all muted. You can please type your questions in the GoToWebinar question pane, and Erica will field them, and we'll try to handle them as we go through, or maybe we'll handle them all at the end. So I've chosen what I think is probably about 5 or 6 topics, or 5 or 6 things that I use within my charting on a daily basis that I think have always tried to help me the most. And in no specific order, we're going to go through those things. So one of the things that I like to do is allow TRAKnet to not only do my charting with some single clicks, but also do my billing with some single clicks, all at the same time. Now, it's going to take some setup on your part, but I feel that once you do this, this is going to allow you to practice and use these templates much more efficiently within your practice, especially for those providers who may be thinking about bringing on younger practitioners who don't do or aren't as familiar with coding as they are with what they do from a clinical and charting standpoint. So what I'm going to do is I'm going to start by clicking on my name, and I'm working directly out of my TRAKnet database, so you'll understand why I've removed the patient list from the left-hand side. So when you click on Manage Templates, the first thing that I'm going to do is I'm going to come down, I'm going to click on the template type, and I'm going to come down and I'm going to click on my treatment templates. And by clicking on my treatment templates, what's going to happen is it's going to bring up this box right here. And what this box does is it allows you to bring up certain codes and will allow you to then associate a template with a treatment code itself. So I'm going to click on that treatment code, and the example I like to give is I'm going to type in 11750, and I'm going to search that, and I'm going to come up with a permanent nail avulsion and matrixectomy. And when I click on that permanent nail avulsion and matrixectomy and click OK, what it does is it allows me to then type into here any template that I would want that could be associated with that code. This template could be anything you want it to be. This is just my example of what when I utilize 11750, this is the template that is associated with it. And anytime I use that code, this template comes up. Now, if you haven't taken the time, whether you're a new user of TRAKnet or even a veteran, the template that is associated with this code might be something very brief, something like matrixectomy performed 1, 2, 3, 4, 5, medial, lateral, or bilateral. This is the area that allows you to change what comes up when you utilize this code. And that's just the first step that you need to do in order to let TRAKnet do your work for you. Associate a template with a code. Once that's done, now I want you to think about the people who aren't very good at billing. Think about those that are very good clinically, your young associates who are very good at what they do with your patients, who are very good at using electronic health records and charting what they do, but they don't know enough about their billing. I want you to allow TRAKnet to do that billing for them. So what you should do at this point is think about where you utilize that code. You utilize that code more in your plan, in your procedure area. So what I want you to do is I want you to bring up, and how I've done is I bring up my plan templates. And then once I bring up my plan templates, I then, of course, have them categorized into all the different subjects or the different areas that you could be doing something. In this case, I'm going to click on my surgical category. And under my surgical category, you're going to see the word matrixectomy. And if I was using that in my encounter, in my charting, you would think that a template was associated with the word matrixectomy. Well, in most of your systems, that's probably the case. But in my system, what I've done is when I click on matrixectomy and I select it, you're going to notice that the only thing that's associated with that template is that code. And I'm going to show you in a few minutes exactly how something like that how that works. Because now what I've done is step one was associating a template with a code, but step two was then associating the code with a mini template, or taking the code and associating with verbiage. Let's not confuse some of the terms. Associate the code 11750 with any type of verbiage you want, and then take that code and associate it with a mini template. So let me show you how that works in the real world. So if we were just to search for a patient, and I'll bring up one of my test patients, and I'll just bring up anyone, and I'm going to start a new encounter, and I'm just going to start a blank encounter. No importance whatsoever. So from this blank encounter, if this was even an existing template and we get to where we need to do, and now I'm in my plan and I want to document what I have done for my matrixectomy. So when I go to my plan and I come to my surgical category, you can see that word matrixectomy. So when I'm about to click on this select, I want everybody to focus their attention back here in the encounter portion, right where my cursor is. The first thing you're going to see when I click select is you're going to see the code pop up for a split second, and then I want you to see what comes up with it. So I'm going to click on select, and for an instant you saw 11750, but now you see the template. And that's just like any other template that you may have in your system. But what I've done again is associated the template with a code. So if I go to the invoice and I come over to my invoice, you can see that I've already done my charting for that. That has helped me become much more efficient in my charting. Now, remember, for those of you who are also very good at coding, it works the same way for any code that you have. So if I was just to type 11750, remember we associated that template with it, it's going to just do the same thing. The only difference between paragraph 1 and paragraph 2 is that with paragraph 2 I typed the code because I knew the code. Paragraph 1 is for all of you who aren't familiar with coding but are very good with your documentation. That's just one example of a way for me to allow TRAKnet to do the work for me. I'm going to close this, and I'm going to move on to my second area. The other thing that I like to do is I like to allow TRAKnet also to save me some clicks. And there is definitely some things that will allow you to save some clicks. So I'm just going to do a real quick, I'm going to type the word subjective, I'm going to type the word objective, and I'm going to type the word plan, just to type them for a second. And you can see when I hover over them, this is really just words in a template. But at this point, if I was in a note, I would then have to come over here under my subjective, under my template area, and then find my subjective templates or my HPI templates. If I would put my cursor here under objective, I'd have to come under physical exam and then start clicking to find them. Well, I want to try to save every click I can. So what I'm going to do is I'm going to use the template selector feature. So when you come over here to text fields, this top one you're going to see is called a template selector. And some of you may or may not even be familiar with what this template selector is. So when you click on the template selector, when you are editing your templates, I'm just going to give myself a little bit more room here. Oops. If I was to put my cursor here, and I clicked on template selector, this box is going to come up. And this terminology says, please add the template type and the placeholder text. What does that mean? Well, in the area for my subjective templates, I want to see my HPI templates, and the text holder field can be any text you want it to be. So in this case, let's just use the same word, subjective. And I'm going to click OK. The two words look the same, but you'll see when I'm here, if I'm hovering here, it just is a word. When I come down here, it becomes a hand, and I'm going to show you that live in a moment. When you come to objective, we're going to use that same template selector button, and in the template type, what do we do under the objectives? We use our physical exam templates, and the word we're going to put there is objective, same word. And plan is not as unique. We're going to use template selector. We're going to add the template type as my plan templates. And again, the word is plan, just for in our SOAP designation. And I'm going to just save this as my blank template. And we're going to start using that as well. So I'm going to start another new encounter. And I'm going to click on my blank template again. I'm going to start another new visit. Now you're going to notice that the words I typed are still just words, subjective, objective, and plan. But you can see what I've put in with the template selector are now yellow. So if you now click on subjective, it's going to bring up with one single click all of the subjective templates that you can choose from. With your objective, it's going to bring up all of your objective templates, and the same thing with plan. Because if I was here under subjective, I would have to then go one extra click to find all of them. First you put your cursor here, then you clicked HPI, then it brought up all your HPI templates. One click. It saves one click there, one click in objective, one click in plan. That's 3 clicks in one template. Associate that with 25 patients in a day. That just saved you 75 clicks in one day alone. And hopefully that's something that has also helped. I'm going to stay within the template itself, and I'm going to just go to the edit portion. As you know, you can edit your templates right on the fly. You can edit those templates right as you need to. It will not, the edits will not be there in your first, in that use of your template, but of course will be there in future use of that template. One of the other fields that I like to make sure that people understand the difference to try to save a click is the difference between the select multiple options and the select one option. So where I'm using the select one option is, again, the place where I'm only going to have a single choice, no matter what. So in this case, if I give a placeholder field on my underlines, and then I use right, left, and bilateral, as we all know, those choices are singular in nature. You could only have one of them, a right, a left, or a bilateral choice. When you use that, you're going to see, and I'm going to put that one there, and then I'm going to use the select multiple options one. And while a lot of it is going to look the same, and I'm going to put right, left, bilateral, once we update this template, and let's close it, and actually we're going to start using it just again. I'm going to just show you that by the difference between those two templates, or those two choices, when you use a single option, you only have to make a single choice, and it will populate. By using the multiple options, if it was the same three choices, remember, it's a click and a click. Another place where you're going to save one click more than anything else. Add that, just add those to the other clicks, and you see how many clicks you could be saving throughout the day. Some other things that I like to make sure we see is making sure you're using the correct link for the date versus, and there are differences between the today's date and the visit date. Remember that the difference between those two is that the visit date is going to work if you're doing your charting and beginning it from the scheduler. If you are somebody who doesn't have the opportunity to finish your charting on all your charting on that same date, if you then go back and complete your charting the following day or 2 days later and you begin your note from the scheduler, the visit date will remain the same. If you have the today's date link, it will, or just the date link, it will not populate with the correct visit date. So you will see in my template here, you're going to see that I utilize the visit date. So it's very important to make sure that you use the visit date. And again, just making sure you know to edit your templates. When you click on your patient data, you can use the drop downs to get to that, but you can also very easily start typing, and by typing it will then bring you to the correct place for visit date. Or if you use the date field, you could see that or people have used, they have used today's date as the link. So it's very important for you, in my mind, for all of your encounters to use your visit date. Moving on to a couple of other things that I utilize all the time within my charting is I want to allow my original charting to populate elsewhere. So for instance, if I'm in my new patient SOAP template, and let's actually just start a new visit and forget all the test data that's in there. Certain things that you're going to see within my encounter or in my note are some fields that I've added in. I've added in an instructions, a referrals, and a referral reason. Why did I put that into my encounter? Well, what I want to do is, while I'm in my encounter, I want to be able to do all the documentation for my CCDA. So why don't I show you what these templates look like, and I'll explain how I've done this. So I'm going to come back over here to my Manage Templates, and the first thing I'm going to do is I'm going to bring up I'll start with my existing template. I utilize mainly two templates. I do a lot. I build my notes, I build my HPI, I build my my physical exam and my plan utilizing my mini templates. So my existing patients and my new patient templates are my two most used. And what you could see is here, what I've done is I am allowing when I am in my encounter, I am making sure to populate these different links that I've created here, because ultimately those are fields that are going to be used within my CCDA. So if I bring up my CCDA to show you what that looks like, if I come down to patient summaries, and I've made, we had given you one, a default, and I made a different one, and I click select, you can see that these are the fields that are within my CCDA that go out to my patient. So I'm going to always populate my HPI in my note. My active problems are going to be populated by my visit problems for that day. The allergies, of course, are going to get pulled in. My medications are going to get pulled in. My smoking status is going to get pulled in from when I'm doing my rooming of the patient and taking that history. The marital status is going to get pulled in. And these are fields that needed to be in there as per CMS for a CCDA. And that's just general patient information. And when it pertains to the visit note, well, you can see that the visit problems get pulled in. The vitals will get pulled in. And now you can see what I'm doing by doing the charting from my note. It pulls in any patient instructions, any referrals to any other providers, and any reasons that I've sent. And I've also put in something so patients will remember any future appointments that are made. Now these fields are all accessible here, except for one, and I'm going to show you how I made that one up. So instructions, so when you come out to the different fields, you're going to have to edit them. So for instance, when you come out, I've created under instructions all different types of instructions that you can use. So once you start making your lists and all your different instructions, all you want to do is when you are in your patient summary and you want to place, when you come down here and you want to place that link, when you come up to your patient data and you want to just type, if you just type the beginning, it'll allow you to click here and drop that link right into your note. Whoops. So if I just click that, you can see how it puts it right into my encounter. I'm going to just unbold that. There we go. The same thing with the referrals to providers. So if I just get rid of that, you can see the referrals to providers are here. And you can edit that also from the different templates, referrals to providers. And then lastly, a reason for referral. Now that was something that I made up because we didn't have a link for it. And let me show you where I put that. I actually just made that a custom field. So if you come down here, I made a reason for referral link, and I'll show you how I built that. So if I come up here to manage fields, these are all the different existing custom fields I have. And one you could see I had was reason for referral. And how did I do that? So let's just say it wasn't here. I could click on add a field, and we could call that reason for referral. Could be whatever you want to call it. Now I want to just edit I want to give that link its values. So by clicking on edit field, what's the reason you were sending your patient out? Pain, infection, poor circulation, whatever it might be. Okay, and once you do that, you just click OK. You can see that you have your different choices there, and then you can click Save. And now that became a new field that you can work with. You close this, you can see that that reason for referral is now a choice here. And by clicking it, it will just become a link within your CCDA. So by putting these different links within my encounter will allow me to get it done within my charting, and then it automatically gets populated in my CCDA and then can be sent out to my patients. So those are my top 6 different choices, things that I think will help you. I know that these are shorter training sessions. So Erica, were there any specific questions that came up while I was demonstrating that somebody would like me to demonstrate for them or show them, or anything that we can do?
Not so much. The only question that came in was one about the ICD-10 codes being embedded into the templates. There is not a way to do that, to my knowledge, if you have found a
No,
trick
no,
or a way
unfortunately,
for that.
no, just because, unfortunately, your ICD-10 codes are so much more specific, you really can't. So the only way I tell people right now is embedding your visit problems link within your encounter, and of course that's going to just come out to your smart sheet and choosing it from there. While I understand that there are certain ICD-10 codes with a one-to-one relationship, such as the green ones that you'll see on my smart sheet here, we couldn't develop Smartsheet for those unique situations. There's so much more uniqueness to ICD-10 that they had to leave it much more broad and could not allow for embedding of codes into the encounters, just like we did in our old TRAKnet version. Are there any other questions?
It looks like that's the only one. If there are no more coming in,
Any
oh,
other? Oh,
one just
somebody.
came in. Can you make a template that allows you to put one custom template for each of the SOAP sections? Therefore, you can just click one question and get the same result in each section.
Who was the nice person who asked that question?
Dr. Timko.
Dr. Tim. I'm actually going to unmute Dr. Timko so we can maybe explain it a little bit more. Dennis, are you
All
there?
Yes, I'm here. Thanks for,
Sure.
yeah, it's a little tricky to ask by
Yeah,
typing it.
sure. So tell me what you're looking to try to do, and maybe I just didn't
Well,
understand what you were saying.
for example, you have an ingrown toenail
Right?
on the right lateral border
Okay.
and on the great toe. So instead of having to go to the subjective and say right lateral border, great toe, and then put another one, an objective right lateral border on the great toe, and then in the plan, performed on the right lateral border on the great toe, is there a way to have it populate by just answering it one
Once.
time?
Yeah. There really isn't. Unfortunately, it's using the hotspots. Do you use the
Right.
hotspots link? Really
Is
just,
that with the picture?
yeah,
I have
that would
not.
that would be, so that would probably be the best way. So let's do this. Let me get my GoToMeeting pane out of the way. So if we just close this and we close that, and we'll just go back up here to our templates, and we'll just open up a blank template again. So if we just came down here and we claim over to hotspots, and we put in hotspots nails,
Right.
and we put that link there, and we just save it. Once we start using that encounter, every place that you put that hotspot's nails, instead of having to have separate fields for it, it's just going to populate there, and it'll do that.
Oh, okay.
Okay, so that was under, so you'll see, so when we're, I'll just go for the edit section here. Edit template, it adds that extra box, that extra one on the end. I want you to just, you put your cursor where you want it, click hotspots, and then it could, when you do it this way, the one you choose will be where it defaults to. So if you chose hotspots bones, the bones image will open. And of course the skin and the nails are always accessible to that, but that'll save you from having to, to bring up a different image right away. Because if it's a nails problem, bring up the nails image first. If it's a bones problem, bring up the bones image first, because it may save you a click here and there. If you want to just make it generic, bring up one, and then you could always get between all of them.
Okay.
All right. Okay. Well, I'm glad that helped. Let's see if any other questions came in.
No more questions. It looks like we are all set.
Wait, let's just make certain. I think one might have just
popped in. There's one. Just popped in. When you choose hotspots, can the hotspot photo be incorporated into the note?
Unfortunately not. It's going to turn it around and become verbiage. Now remember that you can always incorporate, images as attachments within your note. So if you took a photo and got it onto your desktop and incorporated it into multimedia, you can always choose to incorporate that as an attachment into your note. But other than that, there is unfortunately no way to get the image of the nails or the bones into your encounter at this time. All right, well, it looks like we're right at the bottom of the hour, and I want to thank everybody for joining us this afternoon. If anybody, please has any other questions about what we've covered today or anything else about charting, please feel free to use the Ask Dr. Juliana tab within the TRAKnet program. If it's a specific thing that we talked about today or charting, you can actually, although it's going to Dr. Juliana, you can address it to put my name in it. It will get forwarded to me pretty instantaneously from him, and I'm pretty diligent about trying to answer my emails within 24 hours. So I want to thank everybody, all of our users who are here today joining us. Erica, thank you so much for fielding our questions today. And with that, please feel free to join Dr. Juliana on next week's webinar about data analytics and the reasons to outsource your billing. And I know we're going to have more TRAKnet Fast Track training. So thank you, everybody, again for today, and have a great afternoon. Bye-bye.